The anti-pro-BNP test represents a quiet but profound shift in how we understand the heart, because it teaches us that the body does not wait for collapse before speaking. Long before chest pain, dramatic breathlessness, or visible swelling appear, the heart begins to adapt to pressure in subtle biochemical ways. Heart muscle cells, when stretched by excess volume or persistent strain, release pro-BNP as a natural response. This release is not a malfunction, but an intelligent signal, a message sent into the bloodstream to inform the rest of the body that the heart is working harder than it should. In this sense, the test is not hunting for damage, it is listening for effort. What makes this so powerful is that human perception is often delayed, while biology is immediate. A person may attribute mild fatigue to age, stress, or poor sleep, never suspecting the heart is carrying extra load. The anti-pro-BNP test bypasses subjective interpretation and listens directly to the physiology. It captures the early whisper of imbalance before it becomes a shout, offering a glimpse into a stage where intervention can be gentle rather than urgent. This early insight changes the entire emotional landscape of care, replacing surprise and crisis with foresight and preparation. There is also something deeply human in this concept. We often ignore our own internal signals until they disrupt daily life. The heart, however, does not wait for permission to speak. It communicates continuously through chemistry, and pro-BNP is one of its most honest messengers. Elevated levels tell us that the heart is stretching itself to meet demands placed upon it, whether those demands come from high blood pressure, fluid overload, metabolic stress, or years of unrelenting tension. The test, therefore, reflects not a single moment, but a long story written in molecules. From a scientific perspective, this early signaling is elegant. It shows how the cardiovascular system integrates mechanical stress with hormonal response, translating physical strain into measurable data. From a philosophical perspective, it reminds us that health is rarely binary. The heart is not suddenly healthy one day and failing the next. There is a continuum, a gradual shift, and the anti-pro-BNP test allows us to see where someone stands on that spectrum before irreversible harm occurs. Perhaps most importantly, this test reframes how we think about prevention. Instead of waiting for visible disease, we learn to respect early imbalance. We begin to understand that listening is an active form of care. By acknowledging the heart's early signals, clinicians and patients can work together to reduce strain, adjust habits, refine treatment, and restore balance while the heart still has ample reserve. In doing so, medicine becomes less about reacting to catastrophe and more about honoring the body's quiet wisdom as it continually strives to protect life. The anti-pro-BNP test serves as a bridge between what a person feels and what the body is actually experiencing. And this bridge is essential because symptoms alone are often unreliable storytellers. Breathlessness can come from the lungs, fatigue can arise from stress or poor sleep, and swelling may reflect diet or kidney function. Without biological guidance, both patients and clinicians can find themselves navigating uncertainty, relying on impressions rather than evidence. The anti-pro-BNP test steps into this space with quiet authority, offering clarity rooted in physiology rather than speculation. From a scientific standpoint, pro-BNP levels provide a measurable signal of cardiac stress that cuts through overlapping symptoms. When the heart is the source of a person's discomfort, pro-BNP tends to rise in response to ventricular strain. When the heart is not the primary issue, levels often remain low, even when symptoms feel severe. This distinction matters deeply because it shapes the direction of care. Instead of chasing multiple possibilities at once, clinicians can focus attention where it truly belongs, reducing unnecessary tests and treatments while accelerating meaningful intervention. This clarity also has emotional weight. Uncertainty breeds anxiety, and anxiety itself can worsen physical symptoms. When people do not understand why they feel unwell, fear fills the gaps left by unanswered questions. The anti-pro-BNP test helps replace that fear with understanding. It does not label or judge, it simply reveals. In doing so, it allows conversations about health to move from vague worry to grounded discussion, restoring a sense of control and trust in the process of care. There's a philosophical dimension to this as well. Human beings seek meaning in sensation, yet the body operates on mechanisms that are often hidden from awareness. The anti-pro-BNP test respects this divide by translating invisible biological stress into visible data. It honors the complexity of the human organism by acknowledging that feeling unwell does not always point clearly to its cause. Science, in this role, becomes not cold or distant, but compassionate, serving as a translator between experience and reality. Clinically, this translation supports wiser decision-making. Treatments for heart failure differ profoundly from those for respiratory disease, anemia, or metabolic imbalance. By clarifying whether the heart is involved, the test protects patients from misdirected therapy and its potential harms. It encourages precision rather than excess, restraint rather than overreaction, and patience guided by evidence. In this way, the anti-pro-BNP test becomes more than a diagnostic tool. It becomes a guide for thoughtful care. Ultimately, the value of this test lies in how it aligns medicine with truth. It teaches us that listening to biology refines our interpretations of suffering. When symptoms and science are brought into harmony, care becomes calmer, decisions become clearer, and the path forward feels less uncertain for both patient and clinician alike. The anti-pro-BNP test allows medicine to move away from broad assumptions and toward a more precise and humane understanding of each individual heart. For decades, treatment decisions in cardiovascular care were often guided primarily by visible symptoms and generalized protocols. While effective in many cases, this approach sometimes overlooked the unique biological responses of each person. Pro-BNP testing adds a deeper layer of insight by revealing how intensely a specific heart is responding to stress, allowing care to be shaped by evidence rather than routine. From a scientific viewpoint, this precision matters because heart failure and cardiac strain are not uniform conditions. Two people with similar symptoms may have very different levels of cardiac stress at the molecular level. One heart may be struggling significantly while another is compensating efficiently. The anti-pro-BNP test distinguishes between these states, enabling clinicians to adjust medications, fluid strategies, and monitoring intensity in a way that aligns with actual physiological need. This reduces both undertreatment and unnecessary intervention, which is a quiet form of protection for the patient. Precision, however, is not merely technical, it is ethical. When treatment is guided by clear biological signals, patients are spared the burden of excessive testing, aggressive therapy, or prolonged uncertainty. The anti-pro-BNP test supports restraint where restraint is appropriate and action where action is necessary. In this balance, compassion emerges naturally. Care becomes less about reacting to fear and more about responding to truth, fostering trust between patient and clinician. There is also a relational dimension to this test. When patients are shown how their pro-BNP levels change over time, they become active participants in their care. The data is not abstract, it is personal. A rising or falling number tells a story about how the heart is responding to treatment, rest, lifestyle changes, or medication adjustments. This shared understanding strengthens communication and reinforces the idea that healing is a partnership rather than a directive. On a broader level, anti-pro-BNP testing reflects the evolution of modern medicine toward individualized care. It acknowledges that biological systems are complex and that meaningful treatment must respect that complexity. By tailoring decisions to measurable cardiac stress, clinicians can offer care that is both scientifically grounded and emotionally considerate. The heart is treated not as a generic organ, but as a living system shaped by history, environment, and adaptation. Ultimately, this approach honors the dignity of the patient. It recognizes that behind every lab value is a person seeking clarity, relief, and reassurance. When precision guides compassion, medicine becomes quieter, steadier, and more respectful of the body's own signals. The anti-pro-BNP test embodies this philosophy, allowing science to serve empathy and enabling treatment to follow the true needs of the heart rather than assumptions or habit. The anti-pro-BNP test carries an often overlooked message of hope, because it reflects not only stress, but the heart's remarkable capacity to adapt and recover. Pro-BNP rises when the heart is working harder, not as a sign of weakness, but as evidence of effort. This distinction matters deeply. It reframes elevated values as a biological expression of resilience rather than failure, reminding us that the heart responds intelligently to challenge, adjusting its chemistry in an attempt to preserve balance and circulation. From a scientific perspective, this adaptability is one of the most impressive features of cardiac physiology. When treatment reduces pressure, improves fluid balance, or restores metabolic stability, the stimulus for pro-BNP release diminishes. Levels can fall, sometimes significantly, reflecting reduced strain on heart muscle cells. This measurable change offers a rare opportunity to observe recovery in real time. Instead of relying solely on how a patient feels, clinicians can see objective evidence that the heart is easing back toward equilibrium. This capacity for change carries emotional weight for patients. Chronic illness often creates the belief that decline is inevitable and that damage, once done, cannot be softened. The anti-pro-BNP test quietly challenges this narrative. When numbers improve, they affirm that the body is responding, that effort is being rewarded, and that care is making a difference. Even modest improvements can restore motivation, encouraging patients to continue treatment, movement, and lifestyle adjustments with renewed confidence. There is also a philosophical lesson embedded in this process. The heart does not demand perfection, it responds to balance. It does not require dramatic transformation, but consistent relief from unnecessary strain. Falling pro-BNP levels remind us that healing often unfolds gradually, through accumulated small changes rather than sudden reversals. This mirrors human experience itself, where resilience is built through patience, support, and steady adaptation rather than force. In clinical practice, this perspective shifts the tone of care. Instead of focusing solely on risk and limitation, conversations can include progress and possibility. The anti-pro-BNP test becomes a marker not just of disease severity, but of responsiveness. It allows clinicians to adjust treatment with confidence, reinforcing what is working and refining what is not. In this way, medicine becomes a dialogue rather than a command. Ultimately, the story told by pro-BNP levels is one of cooperation between biology and care. The heart signals its burden, medicine responds, and the heart adapts. This ongoing exchange reveals that even under strain, the body retains an extraordinary capacity for balance. When we listen carefully and respond thoughtfully, the heart often finds room to recover, reminding us that resilience is not the absence of stress, but the ability to adapt wisely within it.